Hi everyone, my name is Felicia Patterson, and today I will be presenting on sleep disorders. In this presentation, I will briefly introduce what sleep disorders are and why sleep is so important to both our physical and mental health. I'll then explore their causes through a psychosocial lens, looking at how biological, psychological, and social factors interact in the development and maintenance of these conditions. I will also review the current research on evidence-based treatments, discuss widely used assessment instruments in the field, and explain how assessment data informs both clinical practice and scientific understanding. Sleep disorders are much more than just feeling tired. When sleep is disrupted, it impacts attention, mood, memory, physical health, and overall daily functioning. When our sleep suffers, our ability to learn, work, and connect with others also suffer. These disorders are incredibly common and affect millions of people each year. Because of that, this is a major public health concern, contributing to higher healthcare costs, reduced productivity, and increased risk of chronic illness. This is why awareness and proper treatment matter. To truly understand sleep disorders, we have to look at them through a psychosocial lens. Biological factors like genetics or medical conditions interact with psychological factors such as stress and anxiety, along with social factors like work schedules and environment. Since multiple factors are involved, treatment must also be comprehensive. The American Academy of Sleep Medicine outlined four major categories, including insomnia, sleep apnea, parasomnias, and circadian rhythm disorders. Ultimately, sleep isn't a luxury. It is fundamental to our health. Sleep disorders are far more common than most people realize. About one-third of adults report experiencing symptoms of insomnia at some point, and roughly 10% of these meet the criteria for chronic insomnia. This means that millions of people are consistently struggling to fall asleep, stay asleep, or wake feeling rested. Obstructive sleep apnea is also highly prevalent, affecting around 30% of adults. In many cases, people may not even be aware that they have it, yet their breathing is repeatedly disruptive throughout the night, placing significant strain on the body. These conditions are not just inconvenient, they are associated with serious health risks. Sleep disorders have been linked to cardiovascular issues, depression, and an increased likelihood of accidents due to impaired attention and lower reaction times. Beyond the personal impact, they also place a substantial economic burden on society through rising healthcare costs and reduced workplace productivity. Together, these statistics remind us that sleep disorders are not minor concerns. They represent a widespread and significant health care issue. To understand sleep disorders, we have to look at how multiple factors work together to influence sleep. Sleep problems usually don't come from just one cause. Instead, they develop and continue because of biological, psychological, and social factors that interact with one another. Biological influences might include genetics, medical conditions, pain, or neurological conditions. Psychological factors can involve stress, anxiety, trauma, or unhelpful thought patterns about sleep. Social influences like work schedules, family responsibilities, technology use, or environmental disruptions also play a significant role. When these factors overlap, they trigger sleep difficulties and then reinforce them over time. For example, a medical issue may initially disrupt sleep, stress about not sleeping can worsen it, and lifestyle habits may unintentionally maintain the problem. Understanding this process helps us to see why effective treatment must address more than just one piece of the puzzle. When we look at the biological side of sleep disorders, several key factors come into play. Genetics can influence a person's natural sleep wake patterns, and certain variations in the circadian rhythm gene may make someone more prone to conditions like delayed sleep wake disorder. Brain chemistry is also deeply involved. Neurotransmitters such as GABA, which helps calm the nervous system, and auroxin, which promotes the wakefulness, play a central role in regulating when we feel alert and when we feel sleepy. If these systems become imbalanced, sleep can be disrupted. Medical conditions are another important piece. Chronic pain, asthma, and other ongoing health issues can repeatedly disrupt sleep throughout the night. Psychological factors play a powerful role in sleep difficulties. The hyperarousal model explains that some people experience heightened cognitive and psychological arousal, which makes it hard for the body and mind to fully settle at night. Stress, anxiety, and depression are strongly connected to disruptive sleep and keep the nervous system in a constant state of alertness. Maladaptive beliefs about sleep, such as catastrophizing the effects of a restless night, can intensify the problem and create additional pressure around bedtime. Over time, conditioned arousal can develop where the nighttime routine becomes associated with wakefulness instead of rest, reinforcing the cycle and making sleep quality even harder to achieve. Social and environmental factors play a significant role in sleep health as well. Our bodies function best on consistent routines, so irregular schedules, especially shift work, can disrupt the circadian rhythm and make it difficult to maintain a stable sleep wake cycle. Beyond scheduling, family stress and caregiving responsibilities often require people to stay alert or sacrifice rest, which gradually impacts sleep quality. Cultural expectations around productivity can also contribute, creating pressure to stay up later, wake earlier, or prioritize work over rest. Environmental influence matter just as much. Noise, uncomfortable temperatures, and inconsistent sleep settings can prevent the body from fully relaxing. Light exposure, particularly from our phones, tablets, and television, can suppress melatonin production and delay sleep onset. When these social and environmental factors combine, they significantly interfere with the healthy restorative sleep patterns. Insomnia is the most common type of sleep disorder and one that impacts both mental and physical functioning. It involves ongoing difficulty falling asleep, staying asleep, or waking up too early and being unable to return to sleep. While short term sleep problems can happen during stressful seasons of life, chronic insomnia is diagnosed when these symptoms occur at least 3 nights per week for 3 months or longer. What's important to understand is that insomnia isn't simply about being too tired. It's often maintained by psychological and behavioral factors. Stress, heightened arousal, and racing thoughts can make it difficult for the nervous system to settle. Over time, frustration about sleep can create performance anxiety around bedtime. Habits like spending excessive time in bed, trying to catch up on rest, can unintentionally reinforce this cycle because thoughts, behaviors, and emotional responses all contribute. Effective treatment needs to address more than just the surface symptoms of sleeplessness. Cognitive behavior therapy, or CBT I, is considered the gold standard treatment for chronic insomnia. Rather than solely relying on medication, CBT I targets the underlying cognitive and behavior patterns that maintain sleep difficulties. This includes several evidence based strategies. Sleep restoration helps consolidate sleep by limiting the time in bed to match the actual sleep time, gradually improving efficiency. Stimulus control strengthens the mental association between bed and sleep by reducing wakeful activities in bed. Cognitive restructuring helps individuals challenge unhelpful or catastrophic beliefs about sleep. Relaxation training teaches skills to calm psychological arousal before bedtime. Research consistently shows that CBT I not only improves sleep onset and maintenance, but also producing lasting benefits, making it one of the most effective interventions available. Obstructive sleep apnea involves repeated episodes of airway collapse during sleep, leading to breathing pauses. People often snore loudly or gasp for air. Risk factors include obesity, age, and certain craniofacial structures. Untreated sleep apnea increases the risk of hypertension, stroke, and metabolic disorders, making early detection and treatment essential. The primary treatment for obstructive sleep apnea is CPAP therapy, which uses air pressure to keep the airway open. Oil appliances can reposition the jaw to improve airway. Weight loss and exercise are also important for many patients. In some cases, surgery may be recommended. One challenge is adherence. Many people struggle to use the CPAP consistently. Circadian rhythm disorders occur when a person's internal clock is misaligned with their environment. Examples include delayed sleep wake disorder, shift work disorder, and jet lag. These disorders can be influenced by genetics, lifestyle, and environmental cues like light exposure. Circadian rhythm disorders are often treated with light therapy, melatonin, and behavioral strategies. Light therapy helps to shift the internal clock by exposing the person to bright light at specific times. Melatonin helps to advance or delay sleep timing. The consistent routines and the reduced evening light exposure are also essential in the treatment. Treatment for sleep disorders vary depending on the specific condition and the underlying cause. Evidence based approaches can include behavioral therapies, medical devices, medications, and targeted lifestyle changes. For example, some disorders respond best to structured therapy, while others may require medical interventions or supportive equipment. Overall, the goal of treatment is to address the root cause identified through careful assessment rather than simply managing the symptoms. When the interventions are matched to the specific diagnosis and the contributing factors, outcomes are typically more effective and long lasting. Medications can sometimes be used to help treat sleep disorders, especially for short term relief. However, they are usually not recommended as a long term solution by themselves. Some common examples include zolpidem, which is a type of non-benzodiazepine sleep medicine, or randomelin, which works on the melatonin receptors to help regulate the sleep-wake cycle. Each of these medications works slightly different to help someone either fall asleep or stay asleep. Although they can be helpful, sleep medications may also cause side effects such as daytime sleepiness or changes in thinking or memory, or even reduced effectiveness over time if the body built a tolerance. Because of this, they are most effective when combined with other treatments rather than being used as the only approach. Accurate assessment is key to diagnosing sleep disorders and deciding the best treatment. Clinicians may use interviews, standardized questionnaires, sleep diaries, wearable devices like astrography, and overnight sleep studies called polysomnography. The Pittsburgh Sleep Quality Index, or PSQI, is one of the most widely used self-report tools for assessing sleep quality. It includes 19 items that measure aspects like sleep duration, latency, disturbances, and daytime dysfunction. A global score above 5 indicates poor sleep quality. It is used in both clinical and research settings. PSQI data helps clinicians identify sleep problems and monitor treatment progress. In research, it is used to compare sleep quality across populations and evaluate the effectiveness of interventions. Because it's reliable and valid across different groups, it is a valuable tool for understanding sleep health on a broader scale. Assessment results help guide treatment decisions for different sleep disorders. The information collected can show which approaches are likely to be most effective, whether that's behavioral therapy, medical devices, medications, or lifestyle changes. Ongoing monitoring allows clinicians to adjust treatment as needed and support better adherence. Using a comprehensive approach that considers biological, psychological, and social factors helps ensure that all contributing aspects of sleep problems are addressed. To summarize, sleep disorders are very common and can significantly impact our health, mood, and overall daily functioning. They often have multiple contributing factors, including biological, psychological, and social influences. The good news is that evidence based treatments, such as behavioral therapies, medical devices, or light therapy, can be very effective when matched to the right sleep problem. Tools like sleep studies, questionnaires, and diaries are essential for understanding each person's needs and guiding treatment. Taking a comprehensive approach can lead to better sleep, better health, and an overall improved quality of life. Thank you for watching and taking the time to learn about sleep health.